Hello everyone, and welcome to The Daily Dose with
Dr. Kendra, your OBGYN next door.
and Dr. Tin, your anesthesiologist in the cut. I'm just kidding, in the OR. And we are Doctors Ken and Tin. So here we will be prescribing you with a daily dose of info and reality.
Checks.
All right. Make sure you like, follow, and subscribe to us at Doctors Ken and Tin. All right, let's get started. Okay, so first we're going to talk about why the daily dose.
It's the Daily Dose. Daily Dose. Daily Dose. Daily Dose.
Watch TV today, you see a lot of kind of humdrum. Everyone says the same thing. No one is being authentic or real. And I feel like I wanted to say something else. You know what I mean? Like I wanted to shine light on stuff that we really do talk about. And not even that we really talk about it. The topics might be similar or the same even.
Right.
But what we say, our opinions are real. It's not watered down.
It might be a little edgier.
Yeah, it's not watered down.
And I think
other
that
shows.
the reason why I'm liking how we're teaming up is because we both share passion to educate people.
Yeah.
You know, especially our community. And I think that we're the right combination, which makes us the right dose to deliver everything that's all about
The right dose.
Kendra in Britain. So we are not only going to be providing medical information and education, but also everything that we like. Because I know that, you know, I'm a homegirl and so is Britain. So things that we like, fashion, food, moms, careers, balancing the
Career
husbands.
changes.
It's the Daily Dose. Daily Dose. Daily Dose. Daily Dose.
And a lot of controversial medical topics.
Which people are afraid to talk about.
Yeah, we want to hit those types of things because we know, one, they're very important. They're topics that people actually talk about, but behind closed doors. They're afraid
Exactly.
to talk about it in a forum because they think they'll be judged for it.
Taboo topics like infertility. Infertility is something that makes everybody feel uncomfortable. Abortions make people feel uncomfortable. And we're here
Ashamed.
to
There's a lot
bring
of shame
both
in it.
sides, all viewpoints, you know, not just our own, but all viewpoints. And, you know, sex after having a baby. Politics. So this is a very daring,
Dare she say?
yeah, daring
Dare she
dose.
say?
So you really got to have an anesthesiologist on board because we're more than fentanyl.
It's the Daily Dose. Daily Dose. Daily Dose. Daily Dose.
I'm giving out the doses.
Right, she is.
Not
and
just the
I'm here to
drugs.
make sure that we're not overdoing it. Okay, that's my
Don't
role.
OD.
Okay.
Don't OD.
Don't OD on the daily dose.
On
Okay.
this dose.
Okay, so why, can you explain to everybody our name, like the daily dose?
Okay, so the Daily Dose, we came up
cool.
with this concept because there's two of us. Uno, dos, uno, dos, uno, dos, uno, dos, uno, dos. And we both deal in dosages of medications because we're physicians. So it kind of was a play on words. It's the daily because every day we are doctors, you know,
Right.
dosages of medication,
Right.
and we're always together doing the show. It's always the two of us, so it's the Daily Dose.
And now we're on to the next.
It's the Daily Dose. Daily Dose. Daily Dose. Daily Dose.
You know that COVID and the Black community has been all over the news,
Yes.
especially Chicago. And when I saw on the news that they said Chicago has a lot of cases, and I immediately said, wait a minute, my homegirl's from Chicago.
Yeah.
So how do you feel about that?
So here's the thing. So in Chicago in particular, I think we make up about 10% of the population. However, we make up about 50% of all the cases and almost 70% of all the deaths from COVID. And this is not just Chicago. This is pretty much any major city with a large Black population. We're noticing that we seem to be affected more often and more severely.
Why do you think that is? Like,
well, I mean, let's be honest. Like, we are affected by a lot of ailments,
Right,
More
Black
so,
people,
more
people
so than
of color
any other,
affected more.
yeah, any other culture. So, like, you know, why do we have a higher incidence of hypertension, heart disease, diabetes, things like that? Well, is it because we just aren't taking care of ourselves, or
So we have more underlying conditions in the
exactly.
African American community that puts us at risk
And then there's
of getting sick.
There's the socioeconomic component, right?
Right.
When you live in an area that's underserved, meaning you don't have as many physicians, you don't have quality health care in the sense that you don't have the cutting edge stuff.
Right,
A lot of
the
these patients,
resources.
a lot of patients go to community hospitals that don't have all these resources. They don't have robotic surgery.
Right, lacking funding.
Exactly. They don't have all that stuff, so they tend to get misdiagnosed quite often.
Or the diagnosis is often delayed.
Delayed diagnosis. So there's that component of it where socioeconomics do play a role.
So underlying conditions, socioeconomic status.
And let's talk about the fact that in Black communities, we tend to have more than one generation in a household. So where we're trying to focus on social distancing,
It's impossible.
how
to
do
it
you
in
do
urban
that in a
city.
Black community when you have your grandmama, maybe an auntie, your mama, your kids, like you have several generations in one household where social distancing is nearly impossible.
And it's like if they're saying that if somebody's feeling sick, go in a certain part of the house. A lot of us, it's just one or two
It could be a
rooms.
one-bedroom
There's
apartment.
nowhere to go.
Yeah, exactly. So, there's a lot of components that affect the Black community that affects how we are, taken care of in the medical profession, right? Like we don't get the best of the best.
So it's not a shock for us to hear on the news that Black people we have more conditions. We are getting affected by this virus. And the part where I think that my eyebrow is raising and that we need to do more research is that they're finding out that Black people are not getting tested as much for. So what's happening, they're getting discharged home, cough, shortness of breath, go home, get better.
Now, is that because they don't believe that they have, and so they send them home? Is it because the community hospitals don't have the tests?
I
Because lack of resources?
personally, I believe that it's us sending patients home thinking they don't have COVID.
Not taking them seriously.
Yeah, versus if it's somebody else, they come in with shortness of breath, fever, that maybe they would get tested more or get at least admitted to the hospital. So what's happening is they're getting discharged and coming back with more severe symptoms, requiring them to be
hospitalized
intubated.
and intubated. Exactly.
So that's what's happening, and I think that there's no easy answer. I think,
but it does point to there's a real problem. There's a disparity in the medical treatment of Black folks than other folks, and there needs to be some way to close that gap.
But why do you think that is? That statement
Well,
was very profound.
part of it is what you said. It's funding, right? Why aren't we funding inner city hospitals or community hospitals? Why aren't we hiring more physicians in these areas? Why don't we build the best of the best in areas where you have, minorities? Like, do they have to always go to, the university hospitals, right? Mm-hmm. You know what I mean? Because a lot of minorities, they do have a distrust for the medical profession. They wait longer before they go to the hospital.
And it's funny that you said university
They're sicker
hospitals
by that point.
because a lot of university hospitals are in the inner cities.
Yeah, but they don't
think about
service.
it.
But they don't service a lot of their minority patients.
And that needs
Or
to change.
or a lot of the minority patients just don't feel comfortable going to the doctor because they don't feel like they're taken seriously. They don't feel like they'll get the answers they want. They might feel like they don't even understand the answers that they get. I know when I talk to patients, and this is just my own personal, when I talk to patients, there's been several times, more than several, where I'll explain the actual surgery, what the surgeons should be explaining.
Right.
And I do it in a format where they understand what I'm talking about.
So they understand you better than their own doctor.
Their own doctors don't even explain it. And I've had situations where they're like, oh my God, thank you so much. You are so helpful. You have so much information. I didn't even know that. And I break it down.
So you make it a point to break it down in layman's terms?
Absolutely.
And layman is not
because I understand layman.
Because we don't understand. If you talk to me about, lawyers speak, all those terminologies, I don't understand that. Okay, banking, finance. So layman's term is just, when you're not an expert in the field, and to break it down to people to understand. That proves that you truly understand what you're doing. Because if you're able to take a complex situation and break it down where someone who's not in that field can understand, walk away with a good understanding of what's going on, I feel that is effective communication, and that makes a good doctor to meet each patient where they're at. So to sum it up, Black folks So number one, we have more underlying conditions. Okay, so that's
So
what
go get checked. Here's the other thing. Take.
Tell 'em, tell
you
'em,
You
tell
have
'em.
to. You have
Dr.
to
Jen,
take.
tell 'em.
Okay, I'm gonna tell them.
Listen up.
Listen up. So as Black folks, there is a certain thing called personal responsibility. You owe it to yourself to get yourself checked out, to stay on task with your health care. You can't wait for someone to call you.
You need your
and be
pap
like,
smear.
you have
You
to
need your
come in.
mammogram.
You have
Black
to take
people, get your colonoscopies, please.
check those PSA
Starting at
levels. So
age
your
45.
prostate levels, get your PSA checked. We have to take initiative. You got to be proactive. You can't wait for someone to tell you that you have to go get checked out. Know your medical history, but to know it, you have to go see a doctor. Don't wait until it's too late. Don't wait until you have symptoms. We should be
That's when it's
practicing.
too late. That's when
we
it's
should
too
be
late.
practicing preventative care. Take responsibility, because no one is going to take care of you better than yourself.
Let's make a pledge.
Not even-
2020, let's take care
not
of
even-
ourselves. I'm doing it as
exactly.
well. I personally, like when I talk to my patients, I'm sure you do this, I say we, like everybody could stand to lose at least 5 pounds.
No.
So I say we, except this one. She's like
I'm trying to
invisible
gain
almost.
5
Like,
pounds.
am I by
But it's
myself?
a problem on the
You know
flip
what I mean?
side. Can
And
I hear it out there for all my
little
skinny
booties
people?
need love too.
I'm just saying. It's my pretty little-
Hey.
Girl.
Okay,
listen,
back-
listen, it's just as difficult to gain weight
Those
than
are
to
facts.
lose weight.
Those are facts.
So,
okay. So, secondly, first, Black people, we have more underlying conditions. Second, we can't do social distancing as much because we live in urban cities. And third, we need to look at and investigate why we aren't getting tested as much as the next person.
It's the Daily Dose. Daily Dose. Daily Dose. Daily Dose.
Thank you for stopping by to get your daily dose. Make sure you like, follow, and subscribe to us at Doctors Ken and 10. Until next time, doses.
Attention, please. It's the Daily Dose. Daily Dose. Daily Dose. Daily Dose.